Welcome to the recorded version of Fall Prevention, part of the Family Caregiver Support webinar series brought to you by the American Society of Aging and a generous sponsorship from Home Instead Senior Care. Okay, our presenter today is Lakeland Hogan. Lakeland is a gerontologist and caregiver advocate for Home Instead Senior Care. Lakeland works to educate professionals, families, and communities on issues older adults face. Lakeland is a doctoral candidate at the University of Nebraska, Omaha, where she is studying social gerontology. She has a Master of Arts in Social Gerontology and a Master's in Business Administration from UNO. Lakeland has professional experience in the private and public sectors of senior care services. She has worked on special projects for UNO's Department of Gerontology and the local area agency on aging. Lakeland serves as Vice President of the Board of Directors for the Dreamweaver Foundation and is active in the Alzheimer's Association's Walk to End Alzheimer's. Lakeland has a passion for helping others, especially aging adults and their families. And with that, I'd like to turn the presentation over to our presenter, Lakeland Hogan. Thanks for being here, Lakeland.
Thank you so much, Steve. Hello, everyone. Thank you so much for joining me. I can't believe that we're already at our December event, and this webinar series this year has just flown by. And as Steve mentioned, all of our 2019 webinar topics are out there on the website, so I hope that you'll be joining me next year. We have some great educational topics. They're very relevant to the aging population and family caregivers, and so feel free to check that out and register. You can pre-register for all those events, which is awesome, and you'll get a reminder email. So I look forward to continuing to partner with you in education in 2019. But getting back to today's topic, we're going to be talking about fall prevention. And falls are an issue that are very common among older adults. And it's a topic that gets extra attention this time of year, especially in the cold weather states. The snow and icy conditions can increase the risk of falls, but falls can really happen anywhere. It doesn't necessarily have to be ice or snow related. But falls can lead to serious injury for older adults. But the good news is there is a lot we can do to help older adults prevent falls. And as professionals, we can help provide that education to older adults and their family caregivers. We can talk to them about fall prevention and how they can be proactive as opposed to reacting after a fall and preventing future falls. So I'm so glad that you're joining me today. I hope to share with you some tools and resources that, again, you can pass along to those that you work with. But to get us started, I thought I'd touch on our objectives quickly. My hope is that at the end of today's webinar, you will have learned about the signs that an older adult might be at risk for falls. We're going to also talk about ways to reduce that risk in the home setting. And then you'll also be provided with some resources to help improve home safety, help family caregivers start the conversation with their loved one about falls, and hopefully help reduce the risk of a hospitalization due to falls. So I am excited to share all that information with you, and I thought I'd take a look quickly at some statistics that surround falls here in the United States. In older adults, falls are the leading cause of fatal and non-fatal injuries here in the U.S. According to the Centers for Disease Control, the CDC, 1 in 4 Americans fall each year. Now, I want to pause real quick to just mention that this statistic doesn't take into account what we call a near miss. So this is when an older adult trips but catches themselves, so it doesn't lead to a complete fall. And these can also cause injury, but oftentimes they're not reported as falls because older adults might not see them that way. Their family caregivers might not view that as a fall, but those are some signs that a fall could happen in the future. So we want to take near misses just as seriously as an actual fall because, again, there could be some steps we can take in a preventative way to prevent an actual full-fledged fall that could lead to an injury down the road. But we do know that 1 in 5 falls do cause broken bones, head injuries, some sort of serious injury. And every 11 seconds, a senior is treated in an emergency room for a fall, which equates to over 3 million older people that are treated in emergency departments for falls or injuries on a yearly basis. And then if we break that down in terms of how many deaths this causes, every 19 minutes an older adult dies from complications related to a fall. So these are very serious. Falls are not something that should just be brushed off or ignored. They can really have a serious impact on an older adult's health and well-being. And I just want to share this next slide because it really does show the trend in the number of falls, and unfortunately that trend is increasing. So this graphic comes from the Centers for Disease Control, the CDC, but further again demonstrates that growth in the number of falls that we're seeing in the older population. And as we, as you know, in the United States, our aging population is growing. We know the baby boomers are starting to cross that threshold of 65 and older, and so we're going to likely see this become an increasing problem. So this graph shows that from 2007 to 2016, the fall death rates in the U.S. have grown by 30%. And if these number of falls continue to increase, the number of deaths related to falls will also increase. And data shows right now that there are just over, so there's just over 3 deaths in an hour, but this is estimated to grow to 7 deaths per hour by 2030. So it's really important for us as professionals to educate older adults and family caregivers, care partners about the topic of falls because this is very pertinent issue, again, especially this time of year when many of us are living in states where there are icy, wintry, snowy conditions. So when we talk about the impact that falls have on older adults, there's some specific things that we need to consider. So first, we need to realize that once an older adult has a fall, their chance of falling again doubles. It's also really important for families and healthcare professionals to address the issue of falls with the older adult, especially again after that first fall, because we want to reduce their risk of falling again. Again, we also want to have these discussions if there is a near fall. Again, a near fall is when somebody maybe trips but is able to catch themselves, doesn't fully fall to the ground or to their knees, but it is a sign that there might be some things that need to take place in order to prevent future falls. And as mentioned earlier, falls can lead to serious injuries, some of which include hip fractures, broken bones, and head injuries. Those are kind of the most common that we see. And ultimately, a fall can limit an older adult's independence. 40% of people hospitalized from hip fractures do not return home and are not capable of living independently again. So that is a big factor in fall prevention. Not only do we want to help maintain an older adult's health and well-being, we want to help maintain their independence. So these are the kind of things we can communicate to those older adults that we're working with when we bring up this topic of falls. And again, this topic is not always one that's easy to bring up, especially for family caregivers, but we do know that falls, while they impact the older adult, they can also impact the caregiver. After a loved one's first fall, caregivers have reported a higher level of burden. They might feel additional stressors or might have to take on additional responsibilities in the care of their loved one. I just mentioned that for those that have a hip fracture, 40% of them cannot go back to living independently. So there is an added stress and strain on their family caregivers, the loved ones that are helping to support them. And then the family caregiver also has a fear of falling, maybe not necessarily for themselves, but they fear their loved one might fall again. And again, as statistics show, after the first fall, your chances of falling again doubles. So this is a very legitimate concern, and that can really weigh on the family caregiver. And this could lead to an emotional toll that results in depression for a family caregiver. And it could also cause a change in the routine of the family caregiver. Again, they might have to take on more responsibilities. They might have to stop in and check on their loved one more frequently, that sort of thing. So it really does impact the family as well as the older adult. So when we talk about the emotional toll, we've talked about that in terms of the family caregiver, but falls can also take an emotional toll on older adults. It can also have a financial toll. We know that the average hospital cost for a fall-related injury is about $30,000. So not only can a fall lead to a physical injury, it can also be an overwhelming expense for some families. And while majority of older adults are on Medicare and that type of payment source can help fund the healthcare costs to cover these injuries, we still need to take into account that fall prevention can lead to a cost savings if we're able to prevent an injury. But we also have a psychological impact for older adults in relation to falls. It can elevate their fear of falling. It can also limit their ability to engage in activities, physical activities, social activities, and this could lead to further physical decline. And I will talk a little bit about physical activity and how important that is to fall prevention, but we know that older adults, after a fall, sometimes they have a fear of being active because they don't want to fall again, and that's where it can lead to further physical decline. We need to encourage them to keep their strength up to prevent a fall. We just need to make sure that they're able to exercise or move about in a safe manner. And then it also could increase their risk of depression, social isolation, and feelings of hopelessness. If they have a fall-related injury, things can seem a little hopeless. If they have a fear of falling, they might be less apt to get out and about, and they might not be as socially engaged, so that could lead to isolation, which also could lead to some depression. So these are some things, again, we just need to keep in mind as we're talking with older adults and talking with them about fall prevention. We do know that while falls are not a normal part of aging, the aging process does impact the risk of falls. So the first thing to be aware of is inactivity. As people age, they're less likely to be physically active, and this could be to injury, a chronic condition, low levels of energy, limited mobility, but we need to encourage older adults to continue to be physically active in a manner that is realistic for them, because that inactivity could lead to an increased risk of falls. We also know mobility issues can cause a higher risk of falls. If an older adult isn't properly using an assistive device to move about safely, again, that could increase the risk. Then if we look at medications, we know that older adults take on average 4 to 7 medications. So the combination of these medications or the side effects could cause dizziness, drowsiness that could make falls more likely. So we do know that that's something to be mindful of, and we're going to talk even more about that. And as we age, we have changes to our eyesight. Cataracts, macular degeneration become more common. This can affect depth perception, peripheral vision, and so forth, which again can increase the risk of falling. And our hearing, that can diminish as we age, and so that could prevent an older adult from hearing something in their environment that could lead to a trip or fall. And then nutrition, and we're going to talk a little bit more about that. But malnutrition can really affect an older adult in terms of their energy, their stamina, prevent them from getting up and about their environment. So these are all, again, effects of aging that can really increase the risk of falls for older adults. And these common risk factors, as we're talking about them, you can really group them into 3 categories. So the 3 categories of risk factors are physical, behavioral, and environmental. So first is the physical risk factors. We just went over many of these factors. They can be caused by changes in the body that can increase the risk of falls. And the next category is the behavioral risk factors. And these are things that older adults can do or that they fail to do that can increase the risk of falls. We're going to be talking a lot about prevention in today's webinar, and so if older adults fail to do some of those preventative measures, it could increase their risk of falling. And then finally, the environmental risk factors. And a lot of times when we talk about fall prevention, we automatically think of the environmental factors. How safe is the home? How safe is the environment that they're living in? These home safety risk factors can really help either reduce the risk of falls, or if there is a lack of home safety efforts, could increase the risk. So we're going to dive deeper into all of these risk factors, and most importantly, we're going to be talking about reducing the risk of falling in older adults. So I really like this quote because as we talk about reducing that risk, I think this Benjamin Franklin quote sums it up so perfectly. An ounce of prevention is worth a pound of cure. And I know so often when I'm working with older adults, it's in a reactive manner. Maybe there was a fall or an illness or a hospital stay, and now I'm working with the family to help transition them back to the home environment or back to hopefully living as independent as possible. But if we can get on the front end of this and talk about fall prevention with older adults before a fall ever occurs, or after the first fall that doesn't lead to an injury, then it can really go a long way. And again, as we talked about, falls can be expensive, so can also help save funds from the family or at the government level. And there are really 6 key ways to reduce falls that I'm going to go over today. So I'm going to briefly touch on them on this slide, but I'm going to dive deeper into all 6 of these. Research shows that past falls are the strongest predictor of future falls. So prevention is extremely important. The second strongest predictor of falls is abnormality of a person's gait or balance. So it's really no surprise that exercise and improving balance is the first way to reduce the risk of falls. Even small amounts of physical activity throughout the day can help build or maintain muscle mass and our balance and strength. So we're going to talk more about that in just a bit. We also need to encourage older adults to have conversations with their healthcare provider about falls, whether they're having falls and they need to work with their provider to get to the bottom of why they're falling, or talk to them in a preventative measure. And then medications. I've talked a little bit about this already, but we want to make sure that older adults are reviewing those medications regularly and addressing side effects that might impact their risk for falls. We're going to dive deeper into the vision and hearing and how that is important. We want to make sure older adults are getting those checked annually, and proper nutrition. Again, we want to avoid malnutrition and dehydration to reduce the risk of falls. And then finally, we're going to talk about home safety. And I do an entire presentation on that, so I'm going to give a lot of practical tips and some resources, but that's one of the most important things that we can do is really make sure that the older adult environment is safe, so we are reducing the risk of falls. Statistics show that older adults do not always exercise regularly. 35% of people over the age of 65 also do not participate in leisure physical activities. So we need to really encourage older adults to engage in some sort of physical activity in order to reduce the risk. And again, I mentioned this earlier, but sometimes after a fall, older adults are afraid of falling again and therefore reduce their physical activity even more, which can be detrimental to their fall risk because they might lose that muscle mass. So we do see in research that there's consistent evidence that exercise can help reduce the risk, can help reduce the rate of the number of falls, the risk, and the odds of falling in older adults. Studies also show that balance, flexibility, and strength training can reduce the risk, but a lack of exercise can also help, a lack of exercise can make it more challenging or more difficult for individuals to recover after a fall as well. So the good news is there's many creative, low-impact forms of physical activity for fall prevention that older adults can engage in. Of course, before beginning any sort of new exercise, a physician or healthcare provider should be consulted to make sure that the older adult is in physical shape enough to engage in exercise. There are popular exercises for older adults that can be done. Of course, we've talked about how strength training and resistance training can be helpful in building that muscle mass or maintaining it. Resistance bands are a great way for older adults to build strength in their muscles. Hand weights as well. You could also utilize machines, weight machines at a gym. And of course, older adults want to start light on these weights and on these resistance bands, even in the number of repetitions done, and work their way up as they gain strength. And if an older adult cannot get out of the house, they don't have access to hand weights or resistance bands, even a good old can of soup from the pantry can be enough with enough repetitions can really help an older adult gain strength. So again, just a couple ideas there on how an older adult can engage in strength or resistance training. And then balance exercises. Many gyms and senior centers have yoga or Tai Chi classes that can help older adults with balance. Many yoga studios also are starting to cater to the older yogis. They might have senior-specific classes that are more focused on the low-impact stretching and yoga poses. And you can even do simple exercises at home to improve balance. And I'm going to share some information on some resources for that at the end of today's webinar. And then walking, and that walking is a very inexpensive way of exercising. Some people are intimidated by a gym or a yoga studio, but walking can be done pretty much anywhere, indoors or outdoors. It's a great social activity as well. You can walk with a friend or neighbor, family member. And this time of year, for those in cold weather states, walking outdoors might not be an option. However, you could go to places like a shopping mall and walk around, or a museum. You can even do laps around your house. Go through the kitchen, living room, bedroom. Just getting up and being mobile can go a long way, even if it's just for 5 minutes. And you can also engage in chair exercises at home. A lot of local television stations have chair exercise programs on at a certain hour of the day. You could also ask your healthcare provider or physical therapist for chair exercises that you could do at home. So there are some options for older adults, whether or not they can get out of the house, to engage in exercise. And again, start out light and build up. That's the best way to go about it for all of us. But there's also evidence-based fall prevention programs that are offered at local senior centers, hospitals, and gyms. And so I wanted to just touch on the most popular. Matter of Balance, you might have heard of that one before. This is best for adults with a moderate to high fall risk. This program really emphasizes practical coping tactics to reduce an older adult's fear of falling, and also teaches some of these fall prevention strategies that I'm going over today. It's a more of a structured group intervention activity, so it includes group discussions, skill building, and exercise training that can then be done at home in a sitting or chair exercise type activity setting. Another popular program is Stay Active and Independent for Life. This program is geared towards older adults with a lower fall risk, but as I mentioned, prevention is so key. So even older adults that aren't really at a risk of falling yet, they can engage in programs like this. So this is a physical activity program that increases strength and improves balance in older adults. And so each class involves a warm-up, an aerobic activity, balance activities, strength exercises, and these can all be done in a sitting, standing, or standing setting, and it also includes some educational components. And then finally, the class Stepping On is a program for adults with moderate to high fall risk. And again, these offer strategies and exercises to reduce falls, and it works to increase self-confidence in making decisions and behavioral changes to reduce the older adult's risk of falling. So that's a great program where participants can feel safe standing and walking independently. The program really builds up to that. So again, these are three examples of evidence-based fall prevention programs, and you can find these types of programs at your local area agency on aging. A lot of states have fall prevention coalitions, and so you can look to them for various settings where these programs are offered. Also, local senior centers, YMCAs, hospitals, health clinics, and the County Council on Aging. A lot of those types of institutions have these types of programs. So exercise can really, again, go a long way in helping older adults regain their strength after a fall or be preventative. My grandpa is a perfect example of this. In his early 80s, he tweaked his knee, which really caused weakness, and he ended up having to use a cane, and he was limping about, and he had several near falls. I think he even fell once. I don't know if he would admit that to me, but I think I heard through the family grapevine that it happened. But he really was determined to get his mobility and his knee back. He was not going to be limited in his independence with this knee injury. So he worked with his physician to get to the bottom of it. He worked with a physical therapist, and he also joined his local YMCA's Silver Sneakers program. It's an exercise program. And at first he told me he could only do a few chair squats where you're sitting in a chair and you go from a sitting to standing position. But now he can do a lot of them. He's regained his strength in his knee. He's no longer using his cane, and he's even going to go skiing this winter, which I can't believe. That's how much improvement he has seen. So I know that that's not the case for all older adults, but it just gives you an example of if an older adult is determined to regain their strength and mobility, it could be an option for them. So encourage them to talk to their healthcare provider, which is actually the next topic that we're going to dive deeper into. I mentioned again that while falls are common, it's not a normal part of aging, so it really is important to talk with doctors, your healthcare provider, about your concerns as an older adult. So you want to talk about any past falls or those near falls that I keep mentioning. Older adults also want to discuss any problems that they have with walking or balance. And also they want to talk about any muscle weakness, especially in their legs. My grandpa was a perfect example. He had weakness in that knee, and so he made sure to bring that up with his physician. Also, any feeling of numbness or a loss of feeling in the feet or legs can increase the risk of falls. So that's an important discussion to have with a healthcare provider. In addition to difficulties with breathing, shortness of breath, because if an older adult is experiencing that, they might not be as mobile because they might, when they are mobile, be short of breath, and so they limit their mobility because of that. They also want to talk about any changes in vision, their sleep patterns, if they're experiencing depression, they're having difficulties performing their activities of daily living. They're having issues with any of their chronic conditions. And they also want to talk about their fear of falling. Again, even if a fall hasn't occurred, expressing a fear of falling to a physician can help, again, create that proactive approach to fall prevention. And it's also important for the older adult to bring a full medication list, not just the prescription meds, but all the things that the older adult is taking, vitamins, herbal supplements, over-the-counter medications, because we know that polypharmacy exists and side effects can come about from adverse drug interactions. So we want to make sure that those medication lists are brought to the attention of the doctor. And doctors also, healthcare providers can be a great referral source. So if the older adult is having hearing or vision issues, if they could benefit from physical therapy or occupational therapy. Maybe they need a visit to the podiatrist to have issues with their feet addressed. The healthcare provider can make those types of referrals. And for those that feel unsteady on their feet or want extra security, especially during these icy or snowy wintry conditions, healthcare providers can oftentimes write kind of a prescription for a mobility assistive device or point the older adult in the direction of a recommendation. Maybe they need a cane, and there are several types. There is a one-point cane and then a quad cane, which has 4 feet on the bottom of the cane. Provides a little more stability. And there's walkers, and there's different type of walkers. Do you need one on 4 wheels, a 2-wheel walker, or one that you can pick up and move? And then finally, maybe a wheelchair or scooter is more of a better option for the older adult, even if it is for long distances. So talk to the doctor about those types of mobility assistive devices. You can also inquire about community resources. Perhaps the hospital system that the older adult is a part of has fall prevention programs like that Matter of Balance program. And then finally, you can ask your doctor to evaluate your risk for falling and then recommend specific things that the older adult can do. However, we know that not all physicians are well-versed in talking about fall prevention. They might not know about all of the resources. Actually, there was a study done by Howland and Associates at Boston University that found that physicians might not know about fall risk tools and resources. They found that only 14% of doctors were aware that the Center of Disease Control has a fall prevention assessment toolkit. And so this toolkit is readily available. It's called Stopping Elderly Accidents, Death, and Injuries. You can see the abbreviation there at the bottom. So older adults could inquire if the physician would be willing or healthcare provider would be willing to do an assessment such as that. And the study also found that only 15% of physicians were aware of the Matter of Balance programs. And again, that program in particular is one of the most widely disseminated community fall risk programs. So if your physician's not in the know about those types of programs, you could ask about them and look to those other resources that I mentioned earlier, your local area agency on aging, that type of thing. And it's also key, if you're a professional that is interacting with older adults regularly, if you're the one that is evaluating fall risks, want to make sure that you're asking specific questions. So instead of asking, have you fallen lately, want to be more specific. Have you fallen in the past 6 months or 12 months? Ask, did these falls result in an injury, any bruising? Was there a trip to the ER? Were you hospitalized? The more details we can get, the better in helping to assess how did the fall occur and what are some preventative measures we can put in place. So I mentioned the importance of medication in reducing the risk for falls. And we know that medications are very important in treating health issues that accompany aging, but sometimes these medications, especially those that treat chronic conditions like arthritis, high blood pressure, and diabetes, they might have side effects, especially when mixed with other prescription or non-prescription drugs. And some of these side effects can increase the risk for falls. And when taking medications, especially if the older adult is taking 4 or more meds, we need to communicate the possibility of falls and talk about the risk and how we can reduce the risk. So first, we want to make sure that older adults are having their medication list reconciled on a regular basis. And what that means is they're taking that med list to their doctor, to a pharmacist, to make sure that none of the drugs are having an adverse interaction. We can also encourage older adults to ask for large print labels on their medication bottles. That way they can clearly read the side effects or ask the pharmacist to explain the side effects. We also want to make sure that if an older adult starts taking a new medication and they recognize side effects, or perhaps they have a few near falls or they start to fall, we want to make sure we make the healthcare provider aware that there's that correlation between that new medication and these new side effects. And some common side effects that can increase the risk of falls are dizziness and lightheadedness, a drop in blood pressure, especially when going from a sitting to standing position, difficulties with balance, and a slow response to a loss of balance. For example, if somebody were to walk past and accidentally brush them on the shoulder, if they're not able to steady themselves quickly, that can be a sign that they're at a fall risk. And a loss of concentration, a decreased alertness, and drowsiness can also be a side effect that we want to be on the lookout for, as well as blurred vision. So again, we want to report these side effects to a healthcare provider and ask maybe, is this related to the medication? Is it a common side effect? Maybe the dose needs to be adjusted. Is that med able to be stopped or replaced with an alternative that has less side effects? Those types of conversations need to be encouraged. We talked a little bit about vision and hearing. So when you think about it, your vision and your hearing, you might not automatically associate that with fall risk. However, those two senses really help us navigate our environment. So when either or both are impaired, it can increase the risk of falls. So the Center for Disease Control, the CDC, recommends that older adults have their eyes checked by an eye doctor or optometrist at least once a year and update their eyeglasses or eyewear as needed. We also want to encourage older adults and their family caregivers to be aware of any changes in vision, any issues with visual contrast, or difficulties with spatial relations. I know that many of the older adults that I worked with, their poor vision could lead to trips over rugs or cords in the walkway that they aren't able to see due to their blurry vision. So we want to make sure that walkways are clear. We also want to ensure when it comes to stairs that they're well lit. And if somebody has a visual impairment of some sort, it can be helpful. As you can see in that photo, the yellow strips on the edge of the stairs can really help an older adult visually see the stairs that they're walking up and down. So you can use duct tape. It comes in all sorts of colors these days. You can nail down a plastic traction strip, or you can even paint the stair if it's on an outdoor staircase, if it's cement or something of that nature. So there are little things you can do to help the individual better navigate through their environment if they have visual impairment. Some communities even have low vision centers that you can go to for some added tips and resources. We know that eye conditions such as glaucoma, age-related macular degeneration, and cataracts can also impair vision. So older adults need to talk with their physician, their healthcare provider, their optometrist about treatment options for those particular conditions, whether or not treatment is an option. Maybe even surgery such as cataracts can take place to improve vision and, again, reduce the risk of falling. And then when we talk about hearing loss, that is more common in older adults, so we need to encourage them to get their hearing tested regularly and encourage the use of hearing aids, especially if there are other people in their environment, if there is a pet in their environment. If you think about it, if you aren't able to hear your dog or cat come up beside you and you step backwards, you might trip over that pet. So again, those two senses, our hearing and our vision, can contribute to fall risks if we're not having them checked on regularly. And then I do want to touch on nutrition, because we do know that proper nutrition can aid in the strength and mobility for older adults, and malnutrition, on the other hand, can cause bone loss and limit strength. So we know that as people age, they tend to consume less calories, but that makes it that much more important that they're getting proper nutrients. Want to make sure that they're eating foods filled with vitamins and minerals. We want them to avoid those empty calorie foods and those processed foods. So there's some key nutrients that can help maintain bone density and help maintain or build muscle mass. Protein is one of them. It's important to consume adequate amounts throughout the day. And when less protein is consumed than an older adult needs, that could lead to muscle breakdown, muscle loss, but also to build strength, to grow those muscles, it requires protein intake as well. So that is very important when we're taking into account the nutrition of an older adult. And then vitamin D has been shown to help impact muscle strength, but low levels of vitamin D can be associated with low muscle strength and increased risk for falls. And we also know calcium. I mean, when we were little, we're always told to drink our milk to build strong bones, and we need those strong bones to carry us through the rest of our life. And we know that calcium can help minimize bone loss. And when we have calcium and vitamin D together, it's a perfect pair because vitamin D can help with the absorption of calcium in the bones. So older adults can talk to their healthcare provider to see if they need to increase their nutritional intake in terms of the food they eat with protein, vitamin D, and calcium, or maybe there's a supplement that can be taken. And then we also need to consider hydration. That's really important. And dehydration can put older adults at risk for falling, as it can cause confusion and delirium. So we need to encourage older adults to drink water throughout the day, whether it's carrying a water bottle with them, drinking at least 1 glass of water at each meal, or drinking little cups of water throughout the day can all contribute to the hydration of the individual. We also want to look for signs of weight gain or loss. We know that weight loss can also cause muscle loss for some people, so that's really important. We can sometimes notice this in the way the older adult's clothes are fitting. So pay attention to that, and maybe even encourage the older adult to weigh themselves regularly, either on a daily or weekly basis. And then if an older adult does have a fall, nutrition is really important. We want to make sure that they keep their energy levels up. We want to rebuild their strength, so making sure that they're properly hydrated and they're getting the proper nutrients can lead to a successful recovery. Oh, I apologize. I didn't realize that those bullet points weren't up there. So I'll leave that up there for just a moment. And then the final tip for reducing fall risks is centered around home safety. We know that falls most commonly occur in the home setting and in the bathroom and kitchen areas. So we want to ensure that those two rooms are safe in addition to other rooms of the home. So when we think about the bathroom, we want to ensure that there are non-slip surfaces in the tub and the shower. Installing grab bars by the toilet or bath can help us make sure that the older adult is able to sit and stand properly, and make sure that those grab bars are well anchored to the wall. Raised toilet seats can also be very helpful, as well as a bath seat in the shower or bathtub. And we also want to encourage older adults to wipe up any moisture or spills immediately, especially if there is a tile floor in the bathroom. It can create the perfect storm in terms of falls. And then we want to make sure at nighttime there's a clear pathway from the bedroom to the bathroom, and make sure that maybe even it's well lit. You could use a night light, or I've seen some people even use rope lighting to guide a pathway from the bedroom to the bathroom that they turn on at night, just again to help reduce the risk of falling. And then if we look to the kitchen, we want to make sure that kitchen supplies are stored in easy-to-reach locations. Any heavy items, want to store those in lower cupboards as opposed to having to reach up for them. And want to make sure that if they do have to use a step stool, that it is a very secure one. And again, in the kitchen setting, wipe up any spills immediately. And if floor wax is used, use the non-skid formulas. And also, we need to encourage older adults to assist or ask for assistance if they don't feel safely reaching for that pot or pan at the top of of the cupboard, that sort of thing. And you can even consider creating a cooking station where the older adult maybe has a stool nearby that they can sit down and rest if their legs are fatigued, or maybe a chopping station where they can sit and cut as opposed to standing for long periods. Again, all to prevent falls. And then stairways are another important part of the house. Want to make sure they're well lit, that they have solid handrails. For some, it's helpful to have handrails on both sides of the staircase. We also want to encourage older adults to remove reading glasses when they go up and down the stairs, because the bifocal on the reading glasses can make the stair appear further closer or further away and could cause a fall. We want to also encourage them, older adults, never to rush up and down the stairs. Take their time, concentrate, try not to get distracted while walking up and down the staircase. And again, you can highlight the bottom of the stairs, as I mentioned earlier, with a piece of tape to ensure that the older adult knows that is the final stair at the bottom of the staircase. There's also a great tool around home safety that I wanted to share. This website, Making Home Safer for Seniors, has a great interactive tool. It looks just like the screenshot I have on the slide here. And you can click on each of these rooms, and it'll talk about specific safety hazards in the rooms. And there's also a downloadable checklist where you can print that off and go through the house room by room and assess the safety of each room. And since we are entering winter seasons in many states across the United States, I did want to just talk quickly about winterizing for falls. We know that footwear can be essential to preventing falls this time of year, so we want to make sure that they have proper footwear to reduce the chances of falling, using assistive devices, perhaps even a special cane that they take out with them that has a spike on the end, or special grippers, even having kitty litter in your pocket, which I never thought of, or sand, carrying a little baggie of that can be helpful. That way an older adult can cast that out ahead of them if they see a slippery patch of ice, something of that sort. So even little things like that can really help reduce the risk of falling. And since it is the holiday season, a lot of people are giving gifts to their loved ones. There's just some ideas there of things you can do, gifts you can give, maybe for Christmas or Hanukkah, that can help reduce the risk. So maybe you offer to install a grab bar, or a fall alarm system, emergency alert system can be so vital for older adults, especially if they're living alone. That should be encouraged, and they're making them much more fashionable these days. They're not as clunky as they once were. And then you could also, even a little gift like a flashlight that they can keep on their key ring can help them with improving lighting in certain scenarios. So those are some tips for making sure your loved one is safer, the client you're working with is safer this time of year. And some final tips around falls. Again, we want to engage in a conversation before there is a crisis. And also, it's never too early to engage in preventative activities. Critical life stage for fall prevention activities is actually in middle age. So exercise, strength, mobility, balance, those are especially important to build your strength between ages 40 and 60 to help you maintain that through your older years. And we also want to understand the fall history of those older adults that we're working with, and encourage them to keep a journal or jot down, if they had a fall, where did it happen, when, how did they feel, what were they doing when the fall occurred. That way, when you do talk to your doctor or healthcare provider about the fall, you have all the details and you're not forgetting anything. And finally, before I go to resources, if you do discover a fall, there's some steps that you should take. I will never forget the first time I happened upon one of my older adult clients I was working with who had a fall, and I made sure to remain calm. We want to maintain our composure so we don't get the older adult anxious or any more frightened than they might already be. And if they're injured, we want to not attempt to move them because we could cause further injury. We want to call 911 first, then the family members to alert them. And then if the older adult insists that they are safe to get up, the NIH recommends the following steps. So to roll to one side, get on their hands and knees, find a sturdy chair, put their hands on the chair, and put one foot up at a time, and then slowly rise and rest in between all of those steps. Again, we don't want to cause lightheadedness, so a slow, gradual movement from the floor to a sitting or standing position is best. So hopefully we never happen upon an older adult that falls, but we know that falls do happen. So we want to make sure that we're engaging in safe protocol around that. So now I want to share some resources with you. This first one is a fantastic resource. It's the Fall Prevention Conversation Guide for Family Caregivers. This is published by the National Council on Aging and the National Alliance for Caregiving. You can download the guide at that website on the screen, ncoa.org/fall prevention. But the great thing about this guide is there's conversation starters, checklists, and an action plan. And I took a quick screenshot of the checklist because I love how it asks the question, but then it explains why that question is important. So for example, I have fallen in the past year, yes or no. Why that matters? Because people who have fallen once are more likely to fall again. So again, it helps create that conversation around falls and can help family members identify if their loved one might be at a risk for falls. And again, if you're looking for those fall prevention programs, I listed out where you can find those. Reach out to your local area agency on aging, your local senior center, and so forth. And I want to leave you with these resources here. The American Occupational Therapy Association has some great information. They also have a Falls Prevention Day. I believe it occurs in September, October, but they have some great toolkits around that. So if you work in a community, a senior living community, senior center, and you want to promote National Falls Day, that's a great toolkit on there for you. The National Institute on Aging has some great information. I mentioned earlier that there's videos where you can watch them, and there are exercises on there that you can do at home in a chair or standing position. You can find those at preventseniorhospitalization.com. And then also that home safety checklist, again, you can download that at makinghomesaferforseniors.com. And then the USC Leonard Davis School of Gerontology has a great fall prevention program, and they also have great home safety tips at lifetimehome.org. And then if you want to learn more about that CDC Stop Elderly Accidents, Death, and Injuries Toolkit and assessment, you can download that at the CDC website. So those are some tools and resources. Again, we think back to that quote, an ounce of prevention is worth a pound of a cure. If we're able to engage older adults in a conversation about preventing falls before a fall even occurs, hopefully we'll have the best outcomes. And even if an older adult does fall, there's still so much we can do to prevent a future fall. So I hope that you have found these resources to be helpful, and I hope that you start to engage in conversations around fall prevention with the older adults that you serve or that you care for in your day-to-day. So with that, I will now turn it back to Steve for some questions. Steve, are you there for some questions?
Yes, I am. Sorry.
No, you're fine.
Audio problem there. Here I am. Yeah, it is time for the Q&A, everyone. So please send in your questions at this time. And Lakeland, let's jump right into it here. Can you tell us why do the chances of falling double after a first fall?
That is a great question. If you think about falls, and especially if it leads to an injury of some sort. It can create more mobility issues, that sort of thing. So sometimes an older adult is more limited in their mobility after a fall, which could cause another fall. Also, that fear of falling again can prevent an older adult from engaging in physical activity to maintain their strength and mobility, so that could increase falls again. That's why it's so important to address falls and talk to a healthcare provider about the fall and how it can be prevented. Make sure that the medication list is reconciled. Taking all of those steps can hopefully help prevent the fall from happening again. Maybe we, as a collective body of gerontologists and healthcare professionals and senior care experts, if we're encouraging these conversations, maybe that statistic will decrease. But those are some of the contributing factors to why an older adult would be at a higher risk of falling again. So good question.
All right, thank you. Next question is as follows. So many older adults are in denial that they are at risk. So how do you start a conversation with them or have them assessed?
That is a great point. Falling is, again, it's something that many older adults fear, and they also might associate that with independence. So, for example, or for instance, if an older adult, internally has a fear of falling, if they think they might have mobility issues, they might be afraid to verbalize that because they're afraid that it might come off as a lack of independence, or they don't want to ask for assistance or help. They don't want to acknowledge the fact that they are aging. I would really encourage you to download that fall prevention conversation guide. I'm going to just flip back to that slide. This is such a great resource, and there are conversation starters on this, or as part of this toolkit, that can really help people have a conversation around this. Utilize this checklist, and maybe it's that you don't sit down and say, all right, we're going to go through this checklist right now. You might just print off the conversation guide, print off the checklist, and give it to the older adult and say, this is a great time of year. It's a good excuse, winter months, to talk about fall prevention, especially if you're in a snowy state or a state that has inclement weather, because you can approach it in that way. Icy and snowy conditions are headed our way. I just want to make sure that you're prepared, you have what you need to safely move about the community or your home, that sort of a thing. So that could be a good conversation starter. But just giving them the checklist and saying, I'd really like to discuss this maybe in an hour, or I'll come back tomorrow, or maybe next week when I stop by, that gives them some time to process and think through and gives them a little food for thought. It might not work in every situation, but we also want to maintain the older adult's dignity and respect in this conversation. We want to involve them in some of the solutions. That way, hopefully, they're able and more willing to adopt the maybe home modifications, or maybe be more open and accepting of using a mobility device, that sort of thing. But communicating that it's in the best interest of the older adult, you're doing this so you can help them maintain their independence. It's not that you're trying to take that away from them by any stretch of the imagination. It's really that we're wanting to empower them to continue to move about their environment safely and that sort of thing. So again, download that conversation guide. I think you'll find it to be very helpful. But thank you. That was a great question.
Okay, Lakeland, what if a resident is taking more than one medication and makes them drowsy or dizzy? What's a good way to bring this to their attention to prevent a fall?
That's another great question. We know that drowsiness and dizziness can really lead to a higher risk. So I would encourage, if you're not a family member, if you're in a community setting, bring up this maybe to a family member and talk to them about the risk of falling that's associated with those types of side effects. Encourage the older adult to reach out to their healthcare provider and make sure that their environment is set up to reduce the risk of falls. Make sure that they have an assistive mobility device. But hopefully, if a conversation can be had about the side effect, perhaps there's an alternative drug that the healthcare provider or pharmacist can recommend that would hopefully help reduce the drowsiness, that sort of thing. Or maybe there's just a different time of day that the medication can be taken. So instead of taking it in the morning, maybe it can be taken at night. And that way, if they're drowsy, hopefully they'll, have they won't have to get up and move about in the night, that sort of thing. So those are just a couple suggestions, but certainly bring up the concern to the older adult, and if their family caregiver or family members involved, bring it up to them as well.
Okay, well, Lakeland, we have just about run out of time here. We've reached the 11 o'clock hour. It's time for us to wrap up, but I want to thank you for joining us for a great presentation today. Thank you so much.
Thank you. Have a great holiday season, everyone. We'll see you next year. Bye.